Hi everyone, my name is Heidi El Taous. I'm a certified nutritionist, and in this video I'll talk to you about vitamin D. Vitamin D is one of the fat-soluble vitamins. Fat-soluble vitamins are basically four vitamins. They are vitamin A, E, D, and K. Fat-soluble vitamins need fat in order to be absorbed. Unlike water-soluble vitamins, fat-soluble vitamins can be stored in our body. Functions of vitamin D. Bone mineralization, which means the position of calcium in long bones. It also helps in boosting the immune function and fighting infections. Keeping your vitamin D levels within normal range might help you lose weight, as vitamin D deficiency is strongly related to obesity and insulin resistance. Many factors can affect your ability to get sufficient amount of vitamin D. Poor sun exposure due to spending long time indoors, having darker skin as the melanin prevents its absorption. Having liver and kidney disease will prevent the activation of the absorbed vitamin D. Exclusively breastfed infants need to take vitamin D in the form of drops, around 200 international units, as the mother's milk has no vitamin D. Who are the individuals who need to check their vitamin D regularly? Patients with malabsorption due to inflammatory bowel disease and celiac disease, patients who take corticosteroids for long periods of time, patients with chronic kidney and liver disease. Also, if low calcium was noticed, vitamin D need to be checked. Daily requirements of vitamin D is from 800 to 2000 international units per day, and the maximum daily dose is 4000 international units per day. Sources of vitamin D. The main source of vitamin D is sunlight. Upon exposure to sunlight, our skin has the ability to produce vitamin D with the help of our subcutaneous fat. The rest of the chemical reactions which activate vitamin D takes place in the liver and kidneys. Food sources of vitamin D. Oily fish like salmon, tuna, and sardines, cod liver oil, egg yolk, shrimp, mushroom as a plant source and has weak absorption, and also some fortified food like yogurt, milk, cereals, and orange juice. If you have poor exposure to sunlight, you cannot rely on food alone to get vitamin D. In this case, you need to take vitamin D supplements, either from D2 or D3. D2 comes from plant sources and it has difficult absorption. D3 comes from animal sources and it has better absorption. So folks who are taking vitamin D2 from plant sources, they need to take higher doses because not the whole thing will be absorbed. The recommended daily dose of vitamin D, if it is D3, it will be 1000 international units per day, and if you are taking D2, you might increase the dose to reach up to 2000 international units per day. If vitamin D deficiency has been diagnosed, then a higher therapeutic doses will be prescribed by your doctor. Symptoms of vitamin D deficiency. Generalized fatigue, bone and joint pain, mood swings and depression, obesity and difficulty to lose weight, rickets in children, osteomalacia in adults, low immunity and recurrent infections, and sometimes weakness of bones and teeth. Vitamin D toxicity comes only from supplements if you exceed the daily dose of vitamin D, which is 4000 international units. Symptoms of vitamin D toxicity: gastric upset, nausea and vomiting, elevated blood calcium level, a condition called hypercalcemia, kidney stones due to precipitation of excess calcium in vital organs like the kidneys. So as you can see, vitamin D is quite important but also can be toxic, so make sure that you are taking the proper dose. That was everything for today. I hope you find that useful. Thanks for watching and have a good day.